He's holding back. I think you see it on the stand and other examples too. Here's a man who is torn up by grief, who has conflicting loyalties. You know, he's not my patient. I haven't examined him. I can't tell you for sure. But from the behaviors that we see, that is very telling. It makes my skin crawl, Judge, because when you take it in context, this is as close to an admission of guilt as I think you could possibly hear. He's struggling to come to terms with what he did. And I believe he told us things that are actually truthful, that it didn't start off sexually and it didn't wind up a sexual act. You know, someone who does commit a crime as he's alleged to have committed, this is a sadistic act. This is a sadomasochistic act. Sex is the vehicle for other traumas to these young boys. Dehumanization, objectification, and he's trying to make sense of that without spelling it all out. You know, it's either just a kind of extreme perversion, a kind of regressed objectification of women, something terrible, or it's worse. It could be even some kind of break with reality. We like to go deep into human nature, and unfortunately in this case, the only thing really consistent is the incoherence almost of the behaviors that we're seeing. They're kind of like smoke signals, though. We're not getting a full picture. The beginning of treatment really is surrendering and accepting the fact that you need help and you can't trust yourself to always make the right decisions.
Psychiatrist Dr. John Sharp saying the treatment must be intense and not an excuse.
That can take 6 months, that can take a year, that can take 2 years. I don't think what we're seeing now feels like real change on the part of any of these men. Americans actually are very capable of forgiving, but it can't just be lip service.
I've asked my colleague, psychiatrist Dr. John Sharp from the Department of Psychiatry at Harvard University Medical School to join me because he will be overseeing Dwight's aftercare.
But somewhere inside of me think he moved out because of my use.
Well, you might be right, but you know, you might be wrong, so it'd be good to
Find out
for sure, yeah. This is going to be an important season for Lindsay. You know, she has to not just continue her treatment, she has to actually begin her life again, design it so that she can have a basis for her health and well-being and hopefully for her success as an actress.
The second thing I was thinking of, well, that's an important one, was disposing of all his stuff.
Definitely.
And
is that going to happen before you leave?
Well, I hope so. We have to go to his house and clear out some of that stuff too.
Then I was just thinking along these lines, you know, when you see yourself working out, maybe training for something, or maybe just exercising, you know, you got to visualize yourself doing that and being happy about it without the steroids, right? Because you're going to miss that and you're going to feel like, oh, you know, so I think you ought to just sort of visualize yourself kind of getting past those feelings and continuing with your workout and feeling good about a natural workout and just knowing that's so healthy for you. Even though you're right, it's a diagnosis of exclusion, which just means you have to rule out all other treatable causes. It's not some flimsy diagnosis. It's a psychiatric emergency when there's a decisive, counterintuitive act.
His mind is working very fast. And he'll come up with something which is sort of amazing. It's like, wow, how can he keep coming up with this stuff? But you recognize, as impressive as it is in a kind of sick way, it's not normal. So I just want to make sure everybody realizes this is not some like superhero of the id, you know, as a friend of mine said. It's mental illness. We're looking at something which is ultimately tragic, and I don't think it's going to end well. It's consistent with what patients of mine look like, sound like, and like I say, feel to me like. You know, that kind of colorful use of language, kind of crazy logic, grandiosity. You know, he'll have a turn of phrase.
How tough is this reacclimation going to be for her?
You know, it's going to be tough, Chris, but it's going to be easier than I think a lot of people might expect. We have so much resiliency in us, and following common sense and having safety and support, the right guidance, I think she'll be fine. She can put this behind her. If you face your problems and if you find a way to grow with them, and I think we see that in her. I watched her last statement in the Italian court, and she seemed to be more mature, more forthright, more honestly able to convey who she is. And I think we see a lot of growth, and we can expect growth in the years ahead. She can put this behind her.